Welcome back. The COVID-19 pandemic is wreaking havoc in countries around the world, crashing advanced health systems while overloading others and stretching vital resources thin. As St. Lucia gears up for the war on COVID-19, management and staff of the Victoria Hospital are strategizing for the complete transitioning to the Owen King AU Hospital from Wednesday the 25th to the 27th of March. Glenn Simon tells us more.
A facelift of the prominent outer staircase and front wall at the new hospital, courtesy Harris Paints, who sponsored the travel text, and Make It Happen Foundation, who absorbed the labor cost, was a clear indication that corporate St. Lucia is all in with the transitioning of the Victoria Hospital to the Owen King EU Hospital. With the global outbreak of COVID-19 threatening the economic, social, health and overall well-being of countries, the government of St. Lucia took a policy decision to accelerate the move to OKEU while reserving the Victoria Hospital as a respiratory hospital. Deputy Permanent Secretary in the Department of Health and Wellness, Jenny Daniel, said the government has dedicated 2020 as the year of health in St. Lucia. This week will be absolutely historic for the health sector and all St. Lucians.
While we do not want to take away from the serious focus of COVID-19, transitioning to a new hospital is a very rare occurrence, and therefore citizens of this country will be part of an historic and special moment in the country's national development. As a resilient people, the Department of Health urges everyone to join in its efforts to make this transition a reality.
Executive Director at the Victoria Hospital, Nancy Francis, outlined that intensive training and preparatory activities continued with all stakeholders, including staff, the St. Lucia Fire Service, the Royal St. Lucia Police Force, NEMO, and other government agencies. She called on St. Lucians to play their part in the smooth transitioning of the hospital by first getting their information from only official sources.
Adhere to the directives given by the MOVE team. 3. Adhere to the traffic control measures that will be implemented by the Royal St. Lucia Police Force. 4. The resources of the state will be heavily involved in the transitioning and COVID-19 activities. Therefore, we expect you to discuss within the family how emergency situations will be managed. 5. Persons are advised to take extra care of their health, particularly during the day of the move from Victoria Hospital to OKUH, to avoid or to minimize disruptions in our plans.
Medical Director at the Victoria Hospital, Dr. Alicia Eugene Ford, said to support transitioning efforts, the Castries Wellness Center will operate extended hours from 8 a.m. to 6 p.m. from March 23rd to 30th, except on March 27th, when hours will be extended to 8 p.m. This is to manage non-emergency cases to facilitate the ramping down of services at the Victoria Hospital.
The Grosenet Polyclinic will remain open from 8 a.m. to midnight from Monday, March 23rd, 2020 to Monday, March 30th, 2020, and this will include the weekend. Lab, X-ray and pharmacy services will remain available at the Grosenet Polyclinic during this period.
St. Jude Hospital will assist with the management of emergency cases from March 23rd to 29th. For the protection of patients and staff from COVID-19, Dr. Eugene Ford stated that children below age 10 and adults above age 60 should not visit the hospital during this period. Visiting hours will continue from 6 a.m. to 7 a.m., 12 p.m. to 1 p.m. However, visiting hours will be curtailed to 1 hour in the evening from 5 p.m. to 6 p.m.
We are also asking to limit to 2 visitors per patient that is admitted. And we are encouraging persons to wash and sanitize their hands before and after visiting the patients, and to continue to observe cough etiquette.
As staff and patients gear up for this historic move from VH to OKEU Hospital, citizens are asked to pray for the MOVE team and the smooth and safe transitioning of all patients to the new facility. Reporting for the Ministry of Health and Wellness, I am Glenn Simon.
The COVID-19 outbreak continues to unfold in Caribbean countries as several of them recorded increases in the number of confirmed cases over the weekend or their first cases. Genevieve Gonzague gives us a rundown on the fluid situation with COVID-19 in neighboring countries.
Around the region, countries either recorded their first cases of COVID-19 over the weekend or confirmed increased cases. St. Lucia has confirmed 3 cases of COVID-19, all being imported cases. COVID-19 continues to hit the French Islands hard, with new positive cases being reported every day. On Sunday, the neighboring French island of Martinique reported 44 cases of COVID-19. As of Monday 24th March, Guadeloupe reported 51 cases of COVID-19. St. Vincent has 1 confirmed case of COVID-19, a woman in her 30s who tested positive 2 weeks ago and is expected to make a full recovery. Trinidad and Tobago has confirmed 50 cases of COVID-19. 40 of these cases were individuals who recently returned from a cruise and were immediately quarantined. All of the COVID-19 cases thus far have been imported. In Barbados, 17 patients remain in isolation due to testing positive for COVID-19. Officials warn that persons in self-quarantine who do not remain at home and isolated from others are subject to a maximum fine of $5,000 or 12 months in prison or both. Grenada on Sunday 22nd reported its first case of COVID-19. Dominica also recorded its first case of COVID-19 on Sunday. Jamaica now has 21 cases of COVID-19. A total of 140 healthcare professionals, including 90 specialist nurses, have arrived in Jamaica to help bolster the country's frontline staff in the fight against COVID-19. The healthcare professionals will be quarantined for 14 days, as is the protocol, before being deployed across the island. French Guiana has 18 confirmed cases of COVID-19. Bermuda has 6 confirmed cases of COVID-19. Cuba's confirmed cases jumped Friday as well to 21, but its death tally stayed at 1. The Dominican Republic reported it now has 72 cases of COVID-19. Reporting for Hot 7 News, I am Genevieve Gonzague.
The Sir Arthur Lewis Community College has moved rapidly to scale up online delivery of academic courses, given the suspension of face-to-face classes which came into effect on Monday the 16th of March. According to the Public Relations Officer of the Sir Arthur Lewis Community College, Natalie Jolie-Fannis, these measures are in keeping with the new guidelines and protocols as set out by the Department of Education to aid the mitigation strategies for COVID-19.
Following the suspension of traditional educational instruction, the faculty of the Sir Arthur Lewis Community College has opted to continue instruction via a virtual platform accessible through the school's student website. This was a decision taken to ensure that all students will be able to complete the academic year without need to repeat the semester. Public Relations Officer for SALCC, Natalie Jolie-Fannis, outlined the procedure by which students can access their classes come March 30th.
The Sir Arthur Lewis Community College has suspended all face-to-face classes and will move to online instruction, officially beginning on Monday, March 30th. All students are encouraged to visit the college's website for further guidance on how to use the college's learning platforms. Students who have difficulty with access to the internet or devices are encouraged to complete an online survey that can be found on our social media pages so that we can ensure that all students have access to our instruction.
The college is also working diligently to bridge the digital divide and ensure that no student is left behind. In collaboration with the Ministry of Education, the technical support team has been able to acquire various Wi-Fi packs to be distributed to students in need.
The Ministry of Education has come to our assistance in that regard. Only this morning, they provided the principal of the college, Dr. Keith Nurse, with some Wi-Fi packs, and they will continue to see how they can assist us even with devices for the students.
Lecturers are currently upgrading their skills through a series of online training to strengthen their capacity for live lectures and dissemination of interactive resources, as well as online assessments and monitoring.
The online platform will include instruction, resources, assessments, monitoring. Everything is covered under that platform that we have, and we have an Office for Institutional Effectiveness that is responsible for quality assurance. So they have put policies in place. We had staff training all of this week in terms of the modalities that should be used, the policies that should be followed, and what standards should be maintained. So assessments will be done online as part of the continuous assessment.
A significant number of students have already signed up for the online platform, and a survey of students' online needs is underway to ascertain their access to technology. All practical courses remain suspended. For Hot 7 News, I am Jacka Wooding.
While we have been inundated with thoughts of new coronavirus, youth continue to be innovative and think ahead. We spoke with the technical lead for Guru, a company which is focusing on sustainable development and farming. Jane Hutchinson spoke to us on the importance of youth in agriculture. Genevieve Gonzague tells us more in this report.
Guru, a company which focuses on the development of the agricultural sector by using technology and the resources around us, is building a smart farm that will allow their team to control certain variables to help with producing nutritious and organic foods in St. Lucia.
It allows us to use what we have, more climate advantages like the sun, and because we have long sun days, be able to use these advantages, and when we need to, be able to seal up the greenhouse to be able to control the internal microclimate.
The company has been working on the farm for some time now, but the need for subsistence farming has been brought sharply into focus given the COVID-19 crisis. There has been a call for subsistence farming as well as the need to focus on sustainable development. The company is working on just that. They are on a quest to help farmers produce a consistent amount of high-value crops.
Right now we're looking at peppers and tomato and cherry tomatoes, because these are high-value crops. So if we can prove that they work within the greenhouse context, we can help to transition farmers from growing on externally and increasing their production through the greenhouse. And now we can start to have probably more consistent production, and by linking that production to what the market needs, we can now start to reduce the droughts and the underproduction and overproduction, so the gluts on the market. So if we can now align the production from a farm, because now you can control what's on the farm, and we can link that to what's going on in the market, then we now can start to create a more dynamic agriculture industry.
Hutchinson says Guru is not only working towards ensuring that there is an increase in production for export, but also focusing on the quality of what is being produced to ensure the health and safety of the nation. He is also calling for a greater introduction of science and technology into farming in order to entice the youth who may still be viewing agriculture and farming as plowing the land. Reporting for Hot 7 News, I am Genevieve Gonzague.
This is the Hot 7 TV Nightly News. When we return, sports and the weather.